Alzheimer's Task Force. And just so that you know who we are, I'm Jenny Shaver. I'm the chair of the task force, and I'll let you introduce yourselves.
You want me to start? Okay.
You know,
I'm Lori Alder-Jafon. I'm with the Alabama Department of Public Health.
I'm Nicole Reggiano. I am a professor at the University of Alabama School of Social Work, and I'm also the lead evaluator for the BOLD project.
Casey Hartzog, the Alabama Securities Commission.
well, thank you, ladies, for joining us today. We've had some issues with the subcommittees being able to meet, and Amy Nelson had been the chair for this committee, and she took another job, and so that's why she was not able to move forward with the committee, and so for the ones that could not meet, I'm just doing it myself, and we'll just work with what we have, and so that we can move forward, because our deadline is fast approaching, as we discussed earlier. There were a couple of goals sent out prior to the meeting. That does not limit us to those specific goals and objectives, but just to give us some talking points and a way to get started. So the first suggested goal was to support and promote research and innovation in the field of Alzheimer's and dementia-related diseases. And the first objective, increasing funding by a certain percentage within 5 years. I think we're very fortunate in Alabama. We've had some good grant funds to come into the state that's funded a lot of programs. I really don't know how to specify how much we need going forward. I think it really depends on the other the goals that comes out of the task force and with the BOLD grant to decide how much money we're going to need to fund those items. So I really don't know that we can pin a number on what we think we're going to need without knowing what's been recommended, what action we need to take, and what other programs and ways we can enhance our research and innovation. Do y'all have any thoughts there?
I'm wondering if somehow it could be restructured to where we could, because I don't think we're aware of where the funding may be coming from. There may be funding coming in, so if there's some way to gather that data or to, gosh, I'm trying to think, because in order to measure the increase, we have to know where it's at, like you said, and then try to bump it up by X amount. But if there's some way to assess the funding that's coming in, rather than try to increase it, that seems like it would be more doable to start. But maybe I'm thinking too short term.
No, I think that's where we're at. We're because it's not like we're not doing anything.
Right.
We are. I'm. The more we've gotten into this, I've been very pleased to find out all the things that we were doing statewide, especially in research. There's a lot going on. I mean, we of course got the University of Alabama system and all that they do, but Hudson Alpha, and Amy mentioned a doctor that's doing research at Hudson Alpha that has his own lab, and I don't know if y'all know each other in your world, but it's I actually looked up some of the research he was doing. Dr. Nick Cochran, do you know him? At Hudson Alpha, and I looked up some of the research projects going on, and I mean, you'll know more about this than I do, but the Alzheimer's Disease Research Center at the University of South Alabama, and Auburn Pharmacy Department is looking on new Alzheimer's therapies. And they received a $1.1 million grant from NIH, National Institutes of Health. And let's see, I think it mentioned at Hudson Alpha. I know we gave them like $50 million, not necessarily to the Alzheimer's lab, but to Hudson Alpha. I think it was like for cancer research. That Dr. Cochran, he's working on genetic markers, genetic research in neurodegeneration is the focus of his research. And Hudson Alpha, Dick Cochran, he was awarded a 5-year, $3.5 million grant from NIH. So it looks like most of the federal money is coming through NIH.
Mm-hmm. And I think what you're going to find that the NIH has funded a lot of different types of research, but the majority of it's going to be the actual physical conditions that relate to dementia. So detecting Alzheimer's disease, remedies for Alzheimer's disease. Historically, there's been less, although it has increased over time, for people who are living like more of the social behavioral type research that has been funded at a lower level. So there's been a bigger emphasis on trying to prevent it or to treat it with pharmaceuticals than some of the social things that people need for the day-to-day stuff.
Mm-hmm. Well, and if you look at the study that you did, that was the recommendation that most people put for, they wanted more research in early detection and prevention and early detection. So that kind of follows what most respondents had stated in the study. So I don't know what we would list our action items under trying to establish how, trying to decide how much increase of funding that we'll need in the future.
Would it, I'm wondering if a small group, a subcommittee maybe could be formed as an activity to develop a listing of grant funding that's coming into the state.
Just so we know where it's going and what it's going to.
Mm-hmm.
Like she said, if there's not as much for the biosocial aspect of it, what happens next? Okay, you've been diagnosed, and then what do we do from here? If we can see where all of our funding is going statewide, I think we would better assess.
To assess the gaps and yes.
I have a couple of students that could look all of those things up if that would be helpful.
Okay, great.
Mm-hmm.
So if we develop the task force, assess what's coming in, and then analyze it for gaps.
Mm-hmm.
And then make a
And then make
recommendation. The second objective under the goal to support and promote research and innovation is to establish a research grant program for Alzheimer's and dementia-related diseases and by a time frame. And we don't have that. That's something that we could do as a state. And in looking at other state plans, Georgia has a checkoff on the income tax And so the state uses that money to then fund these research grants. And of course, they take other donations as well to fund those, but as a checkoff, you know, on income tax. So that's, I can tell you that tax cuts and in anything like that, that's a hot topic right now because every single penny of our state income tax goes to the education trust fund, and all of our personal income tax. And so whenever we have any kind of cut or to reduce taxes, then that's considered a cut to the education trust fund. So we do get some pushback on that, but just as that's how Georgia funds theirs. And are you familiar with what the programs that they have in Georgia? I thought this was brilliant. And looking at and I'm kind of jumping ahead and how I plan to talk about this today. But they have, let me just find it. I'll put it off too. They call it the Georgia Memory Net. And it's a partnership between the state and the teaching colleges. I know they use Emory as part of it. Let's see. They started it in 2017 and established 5 memory assessment clinics in 2018, and it took $4.12 million to establish those 5 clinics, and they've opened up 3 more since, and now their annual funding is $7.12 million. So it's state funded but privately managed, and they call them MACs, a memory assessment clinic. And so it's managed by Emory, and they use their employees and students. So the individuals that come in, they're screened by a primary care physician for dementia and at these clinics, and then they get a more precise diagnosis, care plans, schedules for other tests like MRIs, and each memory assessment clinic is staffed by a physician, a community services educator, a neuropsychological tester, and a clinic manager. And these employees are subcontracted through Emory. And so they're students that are majoring in specializing in geriatric care, staff and work in this environment. So they're also learning how to deal with people and get the training, the specialized training in dealing with people with Alzheimer's and dementia-related diseases. So their goal in doing that is to expand care to underserved populations, rural areas, like just because they're just like us, but working with, you know, the providers such as Emory that are already engaged in this research and workforce training. And so I thought that was just a great model because, I mean, we have, you know, UAB, and just to think that if we could somehow make that happen in Alabama, to get those clinics, so that people come in and they've already served over 2,500 people, and I divided up the money. That's about $15,000 per patient that it costs for them to have all of the assessments and the care. And so it's all paid for by the state, regardless of their income. But I just thought that was a really great partnership between the teaching college and the state, you know, to provide the access, to get people assessed early, get the treatment that they need, and also training their workforce. It just seemed like a great plan.
I don't know, Dr. Ruggiano probably knows more, but I know there's quite a way, you know, to go in and get an assessment. So anything that could be done to increase the amount of people that are doing assessments that are knowledgeable in different parts of the state, because not everybody can travel up to Birmingham for an assessment.
Well, I can tell you my personal story with my sister. When she came to Alabama because of her health condition 2.5 years ago, and then trying to get her diagnosed, trying to get her assessed and diagnosed, we were going to every different kind of doctor. And then once we finally got that it's Alzheimer's or a related disease, I called the neuro unit at UAB, and it was going to be April of this past year. Let's see, April of 24. I called in September of 24. It was going to be April. So I got put on I asked to be on a waiting list so that if somebody canceled. And so that happened. So we got in, started going in November, and it took, and we were going every 2 weeks, every other week. We were keeping her appointments and everybody, all the screening and everything that she had to go through and all the tests. So we got the official diagnosis in April of 2024. Her next appointment to be seen is September of this year with Dr. Eric Robertson. So, and plus we're having to drive, so we live an hour and a half away from Birmingham. But thankfully, I have the means to do that, but a lot of people don't. And so that was what we went through, just trying to get her diagnosed and access to care. And now she's stage 4 and in a nursing home. So there's nothing really that can be done for her now. I mean, she's bedridden now. She was not a year ago when we got the diagnosis. She was mobile. But it progressed so fast with her that I really don't know what keeping that appointment's going to do in September. I kind of feel like letting somebody else that might can benefit from it have it versus me trying to take up that space, because I just don't think. So I know firsthand what folks are dealing with trying to get access to the care. And so that's what excited me when I read what Georgia was doing to have the clinics all over the state that provided the assessments to try to get people early and get them treatment. That excited me. I thought, well, it would take a lot to make that happen in Alabama, but you've got to start somewhere.
Right.
So, just wanted to share that. See if there was anything else to add. So I really don't know where that fits in. I guess that would be innovation. If we could work it in under this subcommittee as innovation suggestion.
I'm in agreement for adding it.
Okay. Well, I'll put that in there as well. Were you aware? Had you ever heard of what Georgia's doing? I was not.
No.
I was shocked. I had not heard anything about that at all. And the sad thing is, my sister was a resident of Georgia before she came to Alabama. She just didn't have anybody to help her there, to where she could have had, if she did, she could have had access to that kind of care. But unfortunately, she was stuck with me.
Do you know how long their program has been in place? I'm just wondering realistically, like how,
They started in 2017, and by 2018 they had the first 5 centers, and they've added 3 more since then.
But that was with the state funding to get it set up? Okay.
Yeah. So I'm sure, before that, they were working with Emory for a while, I'm sure, to get everything in place, everything that would have to be worked out, to get all that into place. That's a big goal, but I just thought that was, it was $13,600 per person. And I've got a map of where all the centers are all over Georgia.
Okay.
So it's not just in Atlanta, I mean, they're all, you know, all over the state. They also had some, well, they've got 6 brick and mortar clinics, and then they've got 8 telehealth memory assessment clinics all over the state.
And you said Emory does the training, gets it, all of them set
Yeah,
up? Okay.
they do that. They're contracted to manage it, so they subcontract through Emory to staff the centers.
I'm trying to find my notes, but I was recently at a meeting about telehealth initiatives, and somebody mentioned that Auburn has these clinic pods that they can put in communities, but I haven't learned a whole lot about them. But
That's news to me too.
yeah, so they have
They're doing
something
great work.
that they're trying to advance telehealth that you could look into as well.
That sounds good.
We work with Auburn University with that project with cardiovascular health.
Mm-hmm.
But they do telehealth, and they're expanding. It's part of their rural outreach. Dr. Linda Gibson Young is the contact, and I can send you her information.
Let me make some notes here since I'm having a clerk to my meeting. And I need to back up and finish. I just got so excited to talk about what Georgia was doing about the research grant program. For the action item on that, we could suggest a subcommittee to look into state funding by checkoff. For assessment clinics. One thing that Amy Nelson had suggested was forming an Alzheimer's research work group to link up existing researchers in the state who are working on the disease. Nicole, do you think researchers could talk to each other and share what they're doing?
Yeah, actually, I've recently started building a network of just social work researchers, and we had 50 people sign up like within the first couple of weeks. So one other thing that we could do, I could work with my students, we could pull together a focus group of researchers across the state, and then that would be some information that would be helpful.
Say that one more time so I can type it.
So I can have me and my students, we can pull together a focus group of Alzheimer's researchers across the state. And one of the initiatives that we started with our NSF funding was the Alabama Caregiver Connect program. And this is supposed to make research findings a lot more accessible and understandable to the public. And so we did a focus group during that project, and researchers did think if there was like a common hub where they could learn about what else is going on in the state, and then maybe like support each other in recruiting. So there is some infrastructure that we started building in place that could serve as some support.
I think that's exactly what she was talking about. looking at some other state plans, one thing that Tennessee did, they wanted to make sure that people in the state are aware of opportunities and benefits to participate in research studies and clinical trials, and they even mentioned tissue donation. So I thought that was a good suggestion, just to let people know what's out there to try, where they can go to participate in that.
Do they have a website? Do you know how they get that information out?
I don't know specifically. I might could look further for that. But just, in all ways that we disseminate information to the public.
Mm-hmm.
Department of Public Health has got some really, I've noticed a lot of billboards, and on Fox 6 News, they've even got, commercials dealing with things like foster care and stuff like that kind of surprised me about the advertisement, but in any way you reach people.
Right.
So it surprised me that in the assessment that social media was not listed as a prominent way to receive information, but I think that's how most younger people get their information today.
I think that's part of it. I think there's also more distrust in what people get, and since it's something that they find so important, I think they don't know how to evaluate it.
Plus, our target group is not young people, it's, older population. So they listen to the radio, read the newspapers while what there are left, and watch the news on TV. So, if that's who you're trying to reach, I would think those would be the top three ways to reach older population. But you still need to hit their caregivers. You still need to.
Right, that's what I was thinking. The younger generation will be their caregivers.
The ones that's being their caregivers to let them know where to take them, how to get them help.
Right.
Yeah, good point.
And, she's right. There's probably some distrust or whatever, but I think having any avenue you can use is beneficial. But I know it also comes with
Well, I'm so skeptical when I see something on social media. I look it up and I'm like, that can't be true. And then I, find out, oh, well, it was. It's just, another, from a suggestion I found in the Mississippi plan was to launch a brain aging research website to link individuals and families, medical providers, and researchers to active studies to promote. So it's a website like you mentioned. That was what they did. That was my next, I did see that, put that down next. So yes, a website.
Yeah, the idea with our Caregiver Connect initiative is if we could get even like physician's office to just have posters about it, just having a central place where they trust the information. And in terms of research specifically, just educating them what it means to be in a study. I mean, they might have interest in it, but once they get like a consent form and it looks like a lot of information that's legal, people, so that's one thing that we started to use that site for, like, well, what are your rights if you do ask about it? Like, if you call about a study, you don't have to go through with it, or you can end your participation anytime. Those are things that we're trying to teach people up front, so it makes it a little more accessible as well, not just knowing that it's there, but people feeling confident if they reach out about it.
And I would say having things in like doctor's offices is helpful, because you always have to, you still have to walk in and walk out.
And health departments.
Yeah, and health departments too.
And the AAAs too.
Yes, absolutely, yeah.
That would be a great avenue.
Yeah.
Places where people trust.
That's right.
I mean, just thinking like my personal experience, like I'm thinking of my kid's doctor's office, and there's tons of, pamphlets and brochures and everything by their checkout, and some of it's really good information, there's, you can also use like United Way, they also do like, different things as well. See if they would want to get on board in that direction.
Yeah, through all of this, I mean, our AAAs, I think that's, the way to, yeah, right. Because that's a trusted source for information, it's got your target audience, people who are gonna need the services. And there's one in just about every community or close to it, so we really need to utilize our AAAs to advance our goals.
And like the local like senior centers as well. Could be a place of dispersing information. Because even there, you may catch people before
True, when you're trying to
trying to educate people before
early
they,
detection.
early detection and stuff.
Those are all the items that I identified to talk about.
Can I make one recommendation?
Absolutely.
Just because when we looked across the 6 subcommittees, data is not included in any of the subcommittees. And so it seems like data collection would fall within research and innovation. And so I know at the health department, we have some sources of data, but there's other, senior services, other people. So it would be nice to have a way to sort of pull the data together and then use that data to make informed decisions. So I wrote, and this is very, oh, you know what? I had one other and I forgot to pull it off my printer. Just a way to, if we could add a goal about increasing
I think this is good.
data availability.
Yes. Yes, well, I don't know if she gave you a copy, but the goal is to increase data availability, quality, and utilization. And the objective being to glean through the surveillance strategies and all the other sources to inform public health about programs and policy responses to cognitive health impairment caregiving, and good activities here too, to establish a data work group among the stakeholders and create a plan for collecting and analyzing the data and how to use it to improve program and policy. So this is great. That's very good, very good. So I'll add that to our list as well.
That's something that the student can do this summer. We were talking about this, so we could have them just even call up, see what different agencies have, and then make maybe some sort of list that eventually, we could look into a repository or something like that.
Yes.
And then when you gather all of that information, you can then start to put it together to disperse out. If you have it all in one central spot. So much of the research stuff.
What you think about that second one? Representative Shaver, I did find it. I had one other, just increased data informed decision making and action. And it may be too many goals, but that was just another area.
I don't think so. I mean, we're just making the recommendations. It's up to the bold coalition to decide what to put in it. We're just making recommendations. So I'm comfortable with all of these suggestions. I think it's great.
As part of the BOLD Coalition and the BOLD Project, there are certain uses of data that we have to use with, the health department. We have the behavioral risk factor surveillance system. And so there's two modules that we track, but those are only being done like every 3 years. You know, and so we can look into doing that particular module more often if there's a need to track that data more closely.
And other states do that as well, I noticed.
Yes.
Sounds good. Anything else anybody would like to add? I think we did well coming together off the cuff like we had to do, so just trying to meet our goals.
Well, we have like a standard focus group guide that for multiple stakeholders, but are there specific questions that we would want to ask researchers? So if we organize this focus group, I mean, you could tell me now what you want me to ask them. If there's other things.
Wow. I'll let you know what all we need to include. I think you did very well coming up with the needs assessment. Unless we need a subcommittee to do that.
I think if we, like, we could put it out to the task force or the coalition and ask, you know,
Yeah.
but it's hard to come up with that information without doing some type of research and just looking at it a little bit closer.
I agree.
Yeah, and I can check back in if once we have it scheduled. I can check back in. Maybe if you think about it a little bit longer, something else might come up. But yeah, I can definitely send everybody a copy of the needs assessment, and then we could take it from there.
Sounds good.
I'm sure we'll get a big turnout because a lot of the researchers are very nervous about the future of research. So I feel like if we organize something, we'll have people show up.
Hopefully I've got, hopefully I took good enough notes.
Send us an email, we can try to fill in.
Okay,
if
I'll
you
let
need.
y'all look over it first,
Okay.
make sure I got everything we need, so.
Thank you for pulling the group together.
Well, it just, sometimes I think folks who don't work in the area of government maybe didn't know how to have a meeting or something, I don't know, but we're getting it done.
Yes.
We're gonna get it done, hopefully
I'm excited, we're getting,
me too,
we're making progress.
It's crunch time and we're gonna get there. Well, thank y'all so much, I really appreciate your time and input, and getting these goals and stated, and I'll try to do my best to get them put down. Submit them to the task force, and like I said, I'll probably have that committee meeting on the whole task force on the 31st at 2 is what I'm aiming at right now. The Dr. Gelmarker's committee actually meets on the 26th, and we can turn around and then have it on that Monday and have more time. That's what I'm shooting for at this point. So.
You know, and I'm gonna go back and check because I'm looking on the 31st. I have a healthcare provider, training and education subcommittee meeting at 2.
Okay.
I don't know if it's been moved. I can,
Let me know.
okay,
Just let me know.
let me ask.
Yeah, just let me know.
I'll send an email and follow back up with you.
That'd be great. Well, thank y'all for giving us an audience. Sorry.